Come in. Hi, Mr. Rogers. My name's Evelyn. I'm going to be your nurse today. Hello. Okay, can I have your name, last name, and date of birth? Yes, it's Carl Rogers. Date of birth is 3/15. Okay, and I'm verifying armband. Carl Rogers, date of birth 3/15. MR number is 7718854. And do you have any allergies? No, I don't. Okay. Okay, so today I'm going to do quick patient teaching, okay? Okay, that's fine. Okay, so I did want to teach you about your injection sites. So try to rotate them whenever you're doing your insulin, just so it doesn't, get very tender and bruising and all that stuff. Okay, so it's very important to just rotate your injection site. So if you do it on this side one time, you could do it on the other side the next time. Go ahead and make sure you always examine your feet when you get out of the shower, when you're putting socks on. When you are drying your feet, you need to try to just dry between the toes. Make sure you get all that moisture out of there. And then while you're doing that, you can examine your feet. If you see any, like redness, any swelling, or if you see any kind of lesion or maybe skin breakage, you can go ahead and report that to your healthcare provider. Okay, it's very important in diabetics that we examine the feet. Okay. Also, wearing a medical bracelet is great. If something were to ever happen to you and someone sees the medical bracelet, there's a higher chance of them being able to help you, whether it's a case of just hypoglycemia or whatever it is. We can go ahead and get that taken care of. So you did mention you went to the bathroom earlier. Remember to report any constipation. The morphine that you are receiving for your pain can cause constipation. That's one of the common side effects. So if you do experience any of those symptoms, you could just let us know, and we can try and get you on a laxative, okay? So you can actually go to the restroom if that does happen. Annual eye exams are also very important, so just try to check your eyesight. Again, check your feet, inspect them when you get out of the shower, just whenever you happen to look at your feet as well. When you do cut your toenails, don't cut the corners because we don't want ingrown toenail, okay? So make sure when you cut your toenails, it's right after the shower as well, okay? Okay, sure. Okay, so can you just repeat some of the things we talked about just so I know that you have an understanding of what I just explained to you? Sure. So I'm supposed to rotate injection sites from one side to another. I should get my eyes checked and examine my feet at home. Okay, and when will you be examining your feet? After the shower, and cut my toenails after the shower. Okay, and what kind of jewelry can you have to help? Medical bracelet. Okay, and then what signs and symptoms are you going to report since you are using your since you are being given morphine? Any signs of constipation? Okay, great. So, do you have any questions for me? No, I don't. All right, Mr. Rogers. Well, if you need anything or have any more questions, just let me know, okay? Okay, so bed rails are up, bed is in the lowest position, call light is in place, needs are met. I'm washing my hands and closing the door for privacy.